Alright, here's an in-depth breakdown of each bias category and subtype from that chart. 1. Selection biases. These arise from how subjects are chosen or retained in a study, leading to groups that are not comparable. Sampling ascertainment bias. Non-random selection methods make certain individuals more likely to be included. Example, recruiting volunteers for a diet study. Health-conscious people may overrepresent the sample. Result, sample differs systematically from the population. Non-response bias. When participants who choose not to respond differ meaningfully from those who do. Example, people with poor health might be less likely to complete health surveys. Result, study results skew toward healthier respondents. Attrition bias. Loss to follow-up differs between groups. Example, sicker patients in a drug trial drop out more frequently. Result, remaining sample is no longer representative of the original groups. Bergson's bias. Hospital-based studies where the combination of exposure and disease increases likelihood of hospitalization. Example, studying the link between smoking and pancreatitis in hospitalized patients excludes healthy smokers. Result, associations found in hospitals don't apply to the general population. Survival Neyman bias. Early deaths or very severe cases are missed because data are collected too late. Example, only studying long-term survivors of stroke underestimates true mortality. Result, severe or rapidly fatal cases are underrepresented. Healthy worker effect. Employed individuals tend to be healthier than the general population. Example, comparing industrial workers' mortality to the general public underestimates true risk from exposure. Result, occupational hazards appear less harmful than they really are. 2. Information biases. These occur when data about exposure or outcome are measured or classified inaccurately. Measurement bias. Faulty instruments or inconsistent data collection lead to wrong measurements. Example, using a poorly calibrated blood pressure cuff. Result, systematic error in quantifying exposure or disease. Procedure bias. Different groups receive different care apart from the studied intervention. Example, one group receives more frequent physician visits. Result, differences in outcome may reflect treatment exposure, not the tested variable. Recall bias. Common in retrospective and case control studies. Subjects with a disease may remember exposures differently. Example, mothers of children with birth defects may recall drug use more readily. Result, exposure seems falsely associated with outcome. Reporting bias. Participants selectively report information due to stigma or social desirability. Example, underreporting alcohol or drug use. Result, exposure misclassification reduces validity. Surveillance bias, detection bias. Exposed groups get more medical attention, leading to higher diagnosis rates. Example, patients on hormone therapy get screened more often for breast cancer. Result, disease seems more common in the exposed group, even if risk is the same. Hawthorne effect, observer effect. Subjects change behavior simply because they are being observed. Example, workers improve productivity during observation periods. Result, apparent treatment effects may reflect observation rather than intervention. 3. Cognitive biases. These arise from personal beliefs, expectations, or interpretations influencing results. Response bias. Participants tailor answers to please investigators or appear socially acceptable. Example, overstating exercise frequency on surveys. Result, data reflect perception rather than reality. Pygmalion effect, observer expectancy bias. Investigators' expectations unconsciously influence outcomes or data interpretation. Example, a researcher expecting improvement may rate ambiguous results as positive. Result, outcomes align with expectations rather than actual effects. 4. Preventing bias. Selection bias, randomized subjects, use allocation concealment, ensure follow-up. Allocation concealment, N. Information bias, standardized measurement tools, apply blinding, use placebos. Cognitive bias, double-blind design, standardized data collection, neutral questioning, double-blind design, standardized data collection, neutral, questio double-blind. Would you like me to make a mnemonic table summarizing each bias type?